Hi guys, Brian here from the Sydney and Bondi back pain program. So, what's the most important thing and the very first thing you need to do in terms of addressing long-term back pain that's going to make sure you're on the right road to long-term success? And it's the one thing that no one ever talks about and no one ever does, but it's the most important thing. So usually most people, when they're frustrated, they want that quick fix. You know, what's that one exercise I've got to do? What's the one gadget I've got to buy off the internet that will fix my back pain? What's the one stretch I've got to do? What's the one magic pill I've got to take that will solve all my problems? And the trouble is, if you're in that mindset, you've already kind of skipped ahead of a stage, and it's going to seriously limit your ability to successfully manage your back pain and keep yourself out of trouble. So the most important thing we need to do when the back's bad is we need to investigate what are the postures, the movements and daily habits you've got that sensitize the back to pain. What are the things that you're doing that you might not necessarily realize you're doing that are making that back aggravated? Is it a sitting posture? Is it a standing posture? Is it maybe a movement like a bend or a twist? Is it, when you go in the gym, you try and train heavy, your back's delicate for a few days, or maybe you play sport and then you have a good game of something, or have a good roll or whatever it may be, and the back feels tender afterwards. You need to spend some time investigating what's aggravating the back so that we know what are the things that we need to take away to let the back start to settle. And basically what that is that's like a sort of the first side of a list. That's all the things we need to take away and modify to let the back settle down and desensitize. From that, so from knowing what you shouldn't be doing to aggravate the back, we can then start to build a list of things that you need to do, a bit like brushing your teeth, like spinal maintenance, that help keep the back strong and help desensitize it from pain. So you've got these two lists, things that you don't do because they aggravate the back, and things that you want to do because it helps keep the back pain free. Now for each person, those lists are going to be a little bit different, which is why, when you've got back pain, people are going to say, I walked, I did Pilates, I did yoga, I did this, and then it may or it may not work for you. Like more often than not, for a lot of people, a lot of things generally might not have an effect either way. But there's also danger if you haven't investigated your injury, first of all, you might start doing things that are going to make it worse, which obviously is not a good solution. So if we investigate at the start, what makes it worse, start to build a plan of what things that make it better, that forms the foundation for your long-term strategy for your back. So if you always adhere to those two lists, then your back's got a far better chance of not being aggravated, and then you can also keep it from slipping into that stage because you can hold yourself accountable with things you shouldn't do, things you always need to do to keep it ticking over nicely. Adhere to those lists, and that's your foundation. Once we've got that foundation, then we can start to think about this exercise, this stretch, this soft tissue, this massage, this whatever it may be, and then we can start to build from there. But if you skip that first stage, then it's basically a lottery. There's a good chance you're going to start doing stuff that's going to make it feel worse, and you're not going to understand why, and it's frustrating. So every good back pain rehab program is going to start with a bit of investigation at the start, so that we start to form a clear idea as to why you've got the back pain, and then from there we can work out what we need to do to go forward.